It's actually not possible to get COVID-19 from any of these vaccines because they are not using live virus.
Short-term side effects that were observed in the leading COVID-19 vaccine trials included injection site pain and redness, fatigue, muscle aches and pains, joint pain, and headache.
When one develops these short-term symptoms after receiving the vaccine, that in fact is a sign that the vaccine is working and that your body is marshaling its defense network.
It's important to note that none of these vaccines can give you COVID-19 since they only express a protein from the virus that allows your body's immune system to generate antibodies.
Esto aquí no es solo una máscara, es más que una máscara.
Es un mensaje.
Es protección para nuestras familias.
Se trata de nosotros ayudando a nosotros.
Es para hacer cambios.
Cambios en nuestra salud.
Cambios en nuestra cultura.
Que vamos a darles más que una máscara.
Así que le daremos datos, herramientas e inspiración.
Si vamos a derrotar a COVID-19 en nuestra comunidad.
Vamos a necesitar una máscara y más.
The world is waiting. It's waiting for new ideas, waiting for new solutions, waiting for the next big breakthrough. But scientific discovery takes time, you say. So many possibilities to explore and countless dead ends. If only we could get there faster, which is exactly why CAS is here. Specialists in scientific information. We extract and analyze the world's scientific data so you can build upon the right discoveries. We provide the insights only expert scientists can deliver, so you can leverage new approaches for faster results. And we put big data within arm's reach, so progress isn't just something to be desired, it's expected. That is why we do what we do. To ensure the innovators of the world, like you, are able to meet the greatest needs the world has been waiting for. Together, we will do great things.
Remember when we were young and our parents took us to get vaccinated? Well, now it's our turn to help them because the COVID vaccine is available for older Ohioans. The vaccines are safe, effective, and have been rigorously tested. It will take time to get people vaccinated, but it's the best way to protect our health and help Ohio on the road to recovery. Learn more at coronavirus.ohio.gov. We can all make a difference.
It's okay to feel a little anxious right now.
It's okay to be sad, lonely, or confused.
It's okay to feel angry or like you've lost control.
And it's okay to ask for help. Ohio's Careline is an emotional support hotline staffed with behavioral health professionals. It provides free confidential assistance to help navigate these uncertain times. It's okay to not be okay. With help from Ohio's Careline, there is hope.
Esto aquí no es solo una máscara, es más que una máscara.
Es un mensaje.
Es protección para nuestras familias.
Se trata de nosotros ayudando nosotros.
Es para hacer cambios.
Cambios en nuestra salud.
Cambios en nuestra cultura.
Que vamos a darles más que una máscara.
Así que le daremos datos, herramientas e inspiración.
Si vamos a derrotar a COVID-19 en nuestra comunidad.
Vamos a necesitar una máscara y más.
It's actually not possible to get COVID-19 from any of these vaccines because they are not using live virus.
Short-term side effects that were observed in the leading COVID-19 vaccine trials included injection site pain and redness, fatigue, muscle aches and pains, joint pain, and headache.
When one develops these short-term symptoms after receiving the vaccine, that in fact is a sign that the vaccine is working and that your body is marshaling its defense network.
It's important to note that none of these vaccines can give you COVID-19 since they only express a protein from the virus that allows your body's immune system to generate antibodies.
Good evening and buenas tardes. I'm Diana Gates. I want to welcome and thank you for joining us for this town hall discussion on COVID-19. Bienvenidos y gracias por acompañarnos en este foro sobre el coronavirus. Para nuestro público, este evento está transmitiendo en español vía YouTube en el canal del Ohio Department of Health. For a viewing audience, this event is being simultaneously broadcast in Spanish on the Ohio Department of Health YouTube channel. Today's event was designed with you in mind to address the questions that many Ohioans have around vaccines and their safety. We will be joined by a panel of medical experts, community leaders, and public health professionals that are here to help us answer those questions and provide us with the information that is most important for us to know for our own well-being, our families, and those we love. We want to thank our sponsors, CAS, the Ohio Department of Health, the Ohio Department of Mental Health and Addiction Services, the Ohio Latino Affairs Commission, the Governor's Office of Faith-Based and Community Initiatives, and the Appalachian Ohio Commission. But before we get started, we are honored to have Governor Mike DeWine here with us tonight to provide a few words. Governor.
They've been great partners in this tonight, but also all four of these town hall meetings that we are putting on. And so we thank them very, very much. You're going to hear from the experts in just a few moments. I am not an expert, but I want to just assure everyone that everyone living in the state of Ohio who wants this vaccine is going to get it. We have a scarcity at this point, and I know some people are trying to get it and aren't able to get it, but this is going to get better. We were on a call with the White House this morning, and the vaccine coming into Ohio will continue to increase. So I think tonight is really an opportunity to listen to the experts. I just want to talk to you as a parent and a grandparent and tell you that, Fran and I got our second shot today, and what we're really looking forward to is spending more time with our family. We have a large family. We have 8 children. We have 26 grandchildren. And the toughest thing this past year has been not being able to be that close to our grandkids, not being able to travel, see grandkids who are away from Greene County, our home, and even the ones down the road. During the summer, we would walk down there, but we would have our mask on and we would be outside. And we have 2 new grandchildren born in November. And after we wait another week or so, we're going to be able to hug them. And we're really, really looking forward to that. So getting the vaccine is really an opportunity for families to get together. It's an opportunity for us to really do the things that we have not been able to do, certainly the important things that we've not been able to do as much as we wanted to during this past year. Fran and I had the opportunity on Sunday to go over to the Thurgood Marshall High School in West Dayton. And we talked to a number of people who had just gotten their vaccination. They were waiting the 15 minutes before they could leave. And the sense of relief that they had and the pure joy that they had was just really, really profound. So this is, I think, our ticket to get back to normal life. Please listen to, the experts tonight and share what they say to your friends and your family. You have a great influence. We listen to people we're close to. We listen to family much more than we listen to strangers, or certainly to a governor. So I think you have a great influence. I know you will have a great influence. And I know this is going to be a great evening. I've looked at the speakers. They're going to be very informative and very good. So again, thank you for joining with us tonight. And I know we're going to have a good evening. Thank you very much.
Thank you, Governor. So let's get started with probably the most pressing question that so many individuals still want to understand better. What is in the COVID vaccine? How was it developed so fast? And why is there more than one kind of vaccine? And to answer those questions, I'd like to introduce Dr. Raul Schwartzman, Medical Director of Cardiovascular Medicine with the Cleveland Clinic Foundation and CEO and founder of Foundation for a Fair Future, as well as Executive Deputy Director of the Ohio Department of Health, Lance Hines. Welcome, gentlemen.
Good evening. Honor to be here. And let me start by saying that after a crazy year where everything was so fast, if we have the chance just to reflect a little bit about what happened with these, let's call it plural, vaccines more than vaccine. It's been a humbling, outstanding team effort, international team effort. And as a product of that is the vaccines, the other vaccines we are seeing now. So we'll go back to the fastest prior to this one was 1967 for mumps. So that was 4 years, and what takes usually 10 years, this time it took 1 year. But this was as I said, was a team effort of the pharmaceutical industry, governments, regulatory agencies all across the world that came together, understanding the urgency and the need to come up with a treatment of the devastating condition. So usually stages are taken one after another in a consecutive manner. Here were simultaneously done and with no corners cut. Every process, the regulatory agencies were very careful the way they analyzed the data, the way they requested data. To give an example, when things were advancing quite well, both regulatory organisms at the United States and Europe requested to increase the number of patients included in trials from 8,000 to 30,000. So it was not an idea at any point to speed up a process without being overly professional the way it was done. So when going to your question, what the vaccines have, so there are different kinds of vaccines. The ones currently authorized for emergency use in the United States based on a messenger RNA. RNA carries a genetic material that has instructions to tell cells in the body how to make these proteins. So it's trying to stimulate the defense mechanisms in the body called the immune system to generate those proteins. So once injected, this structure that lives only for a couple of days and doesn't get incorporated into DNA, and that's something that probably will be part of a question later, is in the human body creates proteins. That protein is a part of the protein of the coronavirus, and then the body creates antibodies to react against them to be ready for in case infection occurs. The immune system will respond and defend the organism. So it's genetic material that is short-living, was difficult to generate because of issues that we are all aware about, temperature for transportation, because of the very short life, etc. But again, that was product of a very strong working together from Europe and United States, and with many agencies involved, with thousands of people, brains behind this. And I want to see them also as I said, as a teamwork. We notice in society, looking at those who created the vaccine like the enemy, and they came to do this, and we have all these doubts about what the vaccines were done. Let me tell you that if something that the governor mentioned, and it's a commercial at the beginning before the governor spoke, I think that the vaccines are victims of their own success, because those who are now 60-year-old or a little bit older remember what happened with polio and the sequela of polio and kids with wheelchair. We don't see that anymore, and we give for granted that 97% for mumps or rubella are vaccinated, and we don't see that, and many conditions were eradicated from the world. So now we are probably people focusing more on side effects and on the benefits of the vaccines. But I will leave that open for discussion for later.
Thank you, Dr. Schwartzman. Now I'd like to bring in Executive Deputy Director of the Ohio Department of Health, Lance Hines. Vance, could you share in any sort of answers that you think that are really pressing that the community is still trying to understand in terms of this vaccine and the development of the vaccine, and when we go to these vaccine events, the difference between why there's maybe Moderna or Pfizer being offered and how that influences the response of our community?
Yes, thank you. So as Dr. Schwartzman said, it's really a collaborative effort in the development of these vaccines. And really, scientists had been working on vaccines related to SARS and MERS, which we had outbreaks globally in the past. So they were really ahead of the game when coronavirus came on the scene. And so they were able to quickly adapt those the vaccines they were working on to vaccinate against coronavirus. In addition, as he said, there were really no corners cut here. The vaccine is safe and effective. Additionally, it does take time to develop vaccines, but with the worldwide pandemic, the funding and the collaboration, and also the volunteers, those individuals who volunteered to be part of the clinical trials, thousands of them volunteered, including folks who were over 65, people with chronic medical conditions. In addition, communities of color were part of the volunteer panel. So really, when the FDA was presented with both the Moderna and Pfizer vaccines, all of the I's were dotted and the T's were crossed, and the FDA was able to do their rigorous review and grant that authorization for the Pfizer and Moderna vaccines. We're very pleased that we have 2 vaccines available currently. In addition, there are additional vaccines in development, including the Johnson & Johnson vaccine, which has been submitted to FDA for approval. 2 other vaccines are in their 3rd stage of clinical trials. So really, all 3 vaccines, if Johnson & Johnson gets approved later this week, which we hope it will, they're all very effective in preventing illness and hospitalization and death from coronavirus. So if you go to a clinic, any of those vaccines are equally good. I would encourage all of you to take advantage of the opportunity to get vaccinated. Thank you.
Thank you, Deputy Hines. Now, let's hear from our community leaders and the efforts to ensure that that information that Lance Hines and Dr. Schwartzman shared, that this information is reaching our communities. I'd like to introduce you, Ramona Reyes, Director of Our Lady of Guadalupe Center of Catholic Social Services, who also serves as Vice President of the Columbus Board of Education. Ramona, what is the best source of information on the science of COVID-19 and the vaccine that has been helpful when you communicate with the community?
Thank you. Thank you very much for allowing us an opportunity to talk tonight. We understand many of our families, of our clients have a lot of questions, and it's important for us to get all the facts. So what we've been communicating is that we recommend that they talk to their doctor or a medical expert. I know many of the members of our community may not have a primary doctor, so we ask them to please reach out to some of our free clinics and ensure that they're getting the facts, the actual information. Another recommendation is to go out and find organizations that you trust. Our Lady of Guadalupe Center at Catholic Social Services has been working diligently with the Department of Health to ensure that when we get the information, that we quickly translate it, provide that information on our Facebook to ensure that it's accurate and it's being released into our community. We also translate it. So it is information that's available in Spanish for those of us in our community that are not English proficient. So we recommend that they get as much information to ensure that they make the best decision that is right for them. There is nobody in this community that is asking anyone to do something outside of what they would like to do. But as you're making your decision, we're asking folks to really go out, get the appropriate information. The Department of Health has information out there. So if you go to coronavirus.ohio.gov, the Our Lady of Guadalupe Center. I know that a colleague of mine will also mention her resources, but we ask you to please really go out and talk to the medical professionals, look at the professional medical websites versus trying to get your information from some of our social media guidelines. And as you see tonight, you're also getting information from the governor's office and other officials that have been heavily involved in the creation and dissemination of information.
Thank you, Ramona. I'd like to introduce Leliana Kavanaugh, Executive Director of the Ohio Latino Affairs Commission. You have a very broad network in terms of disseminating information at a state level. Can you talk to us a little bit about the best source of information in terms of the science and how you're kind of addressing that in culture, context, and language?
Definitely. Thank you very much. And we really appreciate the opportunity of being with our community tonight. As Ramona mentioned, coronavirus.ohio.gov is the main hub of information that we are relying upon. A lot of effort has gone into creating infographics, bilingual materials, and reliable sources of information that we can bring to the communities. Through the Latino Affairs Commission and our networks across the state, we try to send that information out to trusted Latino organizations. We also are working very closely with the different departments of health in the local districts as well, making sure that they have access to the information both in English and Spanish. We know that not all information is available in English and Spanish at this point. However, as we learn about more pieces of information that are necessary in both languages, we're working very hard to make sure that those become available. So like Ramona said, it's very important for us to go to trusted sources. And again, the local health departments play a critical role, as well as the coronavirus.ohio.gov website, where you can find bilingual information. I also would like to emphasize that the coronavirus.ohio.gov website is a site that can be translated into Spanish. It has the auto-translate feature. And so there are many different ways to make sure that you are having access to reliable information.
Thank you. Thank you, Lily. I'd like to kind of pose another question to Ramona and Lily, actually. So many of us rely on the counsel and advice of our community leaders, particularly when the information seems unclear to us. And you're probably no stranger to any of these questions. What are some of the benefits of taking this vaccine? Why should I consider taking it? Leliana.
Sure. I think thank you. One of the main reasons and that of your family. We know that right now, our best chance to come back to a new sense of normal life is going to be by taking the vaccine. The benefits of the vaccine are significant. The testing for the vaccine has been very thorough, as it was mentioned earlier. The vaccine is safe. And something that is important to mention is that the vaccine has been tested with diverse groups and communities, and it was developed with the highest possible medical and scientific standards. When they were doing the testing, communities of color were represented in those clinical trials. And I think that is something really important for us to emphasize. With the Pfizer vaccine, about 42% of the participants came from communities of color. And for the Moderna vaccine, 37% of those participants were from communities of color. So this is something important because it reflects the diversity of the United States as a nation, as a whole. And between the two studies, there were over 70,000 participants who were part of this effort, who represented our diverse communities. So I think that that is a really critical piece of information in letting our communities know that we need to trust the process, we need to trust the vaccine, and that have all the information needed in order to make wise decisions as to what is best for you and for your family.
And what I would add would be, why should I consider taking it? As we look at our Hispanic family makeup, we have high degrees of diabetes, heart disease, some of the underlying conditions that would put put us at risk and most likely to have the coronavirus. When we first started having conversations with the Department of Health, Hispanics were actually 4 times more likely to have coronavirus. Why? We also work in areas where we have multiple, like restaurants, warehouses. So we have access in areas where there's more people in closer proximity at the beginning of the infections as they started spreading through our community. We also have a propensity to live in multi-generational houses. So due to the vaccine, many have lost their jobs, many have lost their houses. So they have had to move in with other members of their family or sometimes even friends. So when you're talking about multiple households, multiple health risk, you really have to make the consideration as to what's best for you and your household to ensure that others are not being infected, to make sure that you're not the person that's putting others at risk. So getting that information, ensuring that if you do make that decision to get vaccinated, to go and get vaccinated and ensure that your family unit is intact. So it's definitely something that you have to consider with the underlying conditions and also with the propensity of us working in some of the industries that have more people in the surrounding offices. So we want to make sure that we get that information out.
Thank you. So, I'd like to also pose another question to you both. Can you say something about the individuals in the community who are really concerned about taking this vaccine? So we spoke a little bit about, why you should take it. So how are we addressing the conversation in terms of concerns about the vaccine itself? Can you share a little bit of that, Ramona, in terms of the conversations that you're having within the community?
Absolutely. A lot of times, the Hispanic population, we lack resources and the knowledge and the communication to get those messages out. So there are barriers to reaching our Hispanic and especially our Hispanic immigrant communities because of the language issue. So finding that information on how to access the vaccine, facts from trusted resources, and making sure that we get those messages in the appropriate languages out to our communities can definitely help get us to the right, them to have the right decision that they can make for themselves. We continue to encourage people to go and talk to their doctor, medical experts. But I think the major concern is, am I going to feel safe? Am I going to feel welcome? Is there somebody there if I have a question that speaks my language? We have some dialects that are different than just Spanish within our Hispanic community, but if we can have some interpreters and things like that, those are the questions that our community is really asking. As Lily shared earlier, there is a lot of information being rolled out. As a community leader, I will tell you, I probably get about 2 or 3 pages of information that we are sending out as to where you can go and just get a COVID test to see if you have been infected, where you can go to get the vaccine, where you can go to get information. There's multiple sites. Where do I get information about when it's my turn? So those are some of the concerns that our families are sharing with us. They're really wanting to get information. Some of them are very eager to take the vaccines. Others were a little bit more concerned. Earlier on in the year, we were having a lot of meetings with other immigrant and refugee groups to ensure there was rumors about what was in the vaccine, how it was being disseminated. All that information was out there. So we needed to make sure that we found very creative ways to get that information out, as we were not allowing organizations like ours, we weren't allowing people to come into our buildings. So we were doing a lot of things. Our food pantry was a no-touch pantry. So where we were having those interactions, those were far and few between. When people were having information at the barber shops, at the beautician, where we were able to gather and share resources and information, those things started becoming less available. So utilization of Facebook, teaching people how to create and have a Facebook and ensuring that they're out there checking it and attaching themselves to the correct leaders and organizations that provided the appropriate language. We obviously referred them to the Ohio Latino Affairs website and the state websites, but we also found ourselves going back to the way that we used to deliver information, flyers, and some of the old ways that we were giving that. And what that provided us is the opportunity to then connect and really talk and about concerns about what how and where and how do I get there? What if I lack transportation? What if I lack all these other barriers that would need to be removed in order for people to have access to the vaccine? So those are some of the concerns and conversations that we've been having with the community.
Thank you, Ramona. She spoke a little bit about the creativity in terms of getting the message. Folk medicine, remedios caseros, are so culturally ingrained in our Latino communities. And, we've seen some interesting sort of remedies. I'd like to pose this question to Dr. Schwartzman. Are there home remedies that can prevent me from getting COVID or that can take the place of the vaccine?
How much time do you have? 6 minutes? No, there isn't. We can use now the other 6 minutes for something else. No, seriously, no, there is nothing. There's none. I'm not aware of any home remedy or remedio casero for anything. It's not scientifically proven. I would not try myself. But can I use the time, just not the whole time, but to go back to the previous question? I
absolutely
100% or 200% agree with Ramona. The fact that we are dealing with the most vulnerable within the vulnerable, which is the abuelitas, los abuelitos. So for them, Facebook is like, to me, rocket science. For them, social media is the name of a sneaker. So it's impossible. So talking about flyers inside the La Prensa, going to La Bodega. One more thing, 96% of the Latino community, Hispanics, they listen to the radio and watch TV. And that's something that has not changed since the 50s. And so we have to use those means of communication to reach that community. So they will listen to not just, somebody says, not just the message, but the messenger, the importance of who is conveying the message in their language. But also, again, radio, TV, and local through La Prensa, through flyers, etc. The question was also why it's important to vaccinate. And so although we are individuals, we're part of something much bigger than us called society or community. And the fact that no vaccine so far has been approved to use on younger than 16 years old. So we have a big chunk of the population who, to start with, cannot be vaccinated. Those who are seriously ill probably will not get vaccinated. It's left to pregnant women to a discussion between them and their doctors to decide pros and benefits. So pros and cons. So therefore, and if we know, we heard about the concept of community of herd immunity, for which we don't know yet the number we have to reach, but let's say 75% of the community needs to be vaccinated. So let's think of an act of solidarity to get vaccinated. I just not do it for myself. I do it for those around me for that one reason or another, because they are afraid, because they don't have transportation to get the vaccine, because they are too old or too sick, because they are pregnant and they don't want to, because they are younger than 16. I do it also for them, because if most of us, 7 out of 10 probably, 8 out of 10 get the vaccine, those vulnerable get protected and will move from a pandemic to an endemic, will be a virus circulating, but not being so nasty as it is right now. And with the act of all of us putting a little contribution in society to achieve what is called herd community immunity. Sorry if I didn't spend much time on remedios caseros, but I wanted to convey this message. Thank you.
Oh, thank you. Thank you. That was absolutely perfect. we established that the vaccine and masking and social distancing are really the most important steps that we can take to really keep ourselves and our communities healthy. So I'd like to bring Lance Hines back into the conversation. Can you tell us, how can I get this vaccine? I know these are questions that people are still looking to address. Will the vaccine be available in my community at times that are going to be convenient to me? Does the vaccine cost money, and how can I get the vaccine? And how am I going to know when I'm going to be eligible to receive the vaccine?
Yeah, thank you for that question. So we're currently distributing the vaccine in all 88 counties in Ohio. We have just under 700 providers who are providing the vaccine, and those providers include hospitals, pharmacies, both retail chain pharmacies and independent pharmacies, also local health departments and federally qualified health centers. So it's widely available through those 4 channels. And we currently receive about 240,000 vaccines a week from the federal government. Those numbers are increasing, which is a very, very good development. So we are getting that vaccine out into the communities for individuals who decide to take the vaccine to make it available to them. As I mentioned, we are using many pharmacies, and to your point about getting it when it's convenient for you, we've asked our clinics to provide evening and weekend hours. We know many people can't take off time from work or may not have transportation. They may need to rely on a ride. And so sometimes those added barriers necessitate evening or weekend or flexible hours. So we've urged our providers to do that. In addition, you asked about cost. There is no cost for the vaccine. The federal government has provided the vaccine for free. Importantly, there's really no out-of-pocket cost for individuals. And while the vaccine is free, providers can charge Medicaid or private insurance an administration fee, and that's the cost of actually putting the shot into the arms. However, no one will be turned away if they cannot pay, and we will not ask for payment for that administration fee, but they can bill for that. In addition, we will be expanding the types of providers as vaccine supplies increase. So really, the more vaccine we have here in Ohio, we will make it easier for folks to get. And I want to tell you about a resource on our website, and you can go to vaccine.coronavirus.ohio.gov, and you can put in your county or your zip code, and it will pull up a map with vaccine providers who have vaccine that week. And then you can click to the link to their website to register. It'll also have their phone numbers, so you can easily find out where vaccine is in your community. Finally, I want to touch base on the last part of your question in terms of eligibility. Currently, Ohioans age 65 and older are eligible for the vaccine, and we know that our older Ohioans have suffered more severe impacts, illness and death based on age. In addition, a certain subset of individuals with very severe medical conditions are currently eligible. So age 65 and up, if you meet certain conditions that are listed on our website, you can get the vaccine if you choose to receive it. I do know that Governor DeWine has indicated that we will be lowering that age down to 60 soon. We don't have a date yet, but we will continue to lower that age as we have more vaccine. Thank you.
Thank you, Lance Hines. I appreciate that. Moving to 60 is certainly welcome news because so many people are looking for this vaccine. Leliana and Ramona, can you speak to the conversations that you're having in terms of addressing community outreach efforts to get this this vaccine out into the community and in partnerships? Can you speak to some of the efforts that are going on at the local community level?
Sure. This is Lily, and I think that it's really important to recognize the hard work of Latino serving organizations all across the state. While we'll be having this conversation, they have been hard at work throughout the entire pandemic, being the channel of communication, the trusted channel with many people, trying to help them understand how to function in this environment of the pandemic. So a big shout out to all of these nonprofits and Latino serving organizations across the state that have been incredible partners. Also, I want to emphasize the critical role that Latino media has played in this effort. Through Latino media, trusted channels, through whether it be using social media, using the radio through La Mega Radio, Mujer Latina Today, all the different newspapers that are out there helping us get the word out. They have been crucial partners in order for us to be able to inform the community about the process. What we have to understand is that for many Latinos, this will be the first time they're taking a vaccine in the United States. Many of them are first generation, so this is all very new to them. They don't understand the process or the procedure. And on top of that, we have that challenge of the language limitation. So we are working very heavily with the Department of Health as well as the local leaders and departments of health, trying to explain the process, and we will continue to do so. What we keep telling folks is like, think of making this appointment as if you were going to make an appointment for any other doctor's visit. A lot of these pharmacies are near where the people live. Many of these pharmacies are making available information in Spanish as well as other languages, so that will facilitate the process. We acknowledge and recognize that one of the challenges we have right now is supply. And so, of course, many times when you try to make that phone call, there is a long waiting time, or you may have to call again. We encourage people to continue to do so. And most of all, if you are able, please use the coronavirus.ohio.gov website to access the dashboard and find out who are the providers in your area. But again, if you don't have access to those resources, we encourage them to connect with trusted Latino serving organizations in the different areas of the state. The other thing I want to point out is that a lot of the strategy that we have been developing here with the Department of Health and the Latino Affairs Commission and the governor's office has had wide input from Latino leaders. And through many, many weeks, we have had different groups of individuals, advisors from the community who live among you, who represent you, who have been able to come forth and explain to us what are the challenges that the community faces in this situation, what are some of the ways how we can better work with the community. And that input has been extremely valuable as we develop the strategy, not only to reach out to Spanish speakers, Latinos, but also to many of the other ethnic and diverse communities in the state. So we want to thank all of those leaders that continue to provide advice to us. And I want to make sure that you are trusting and you know that the voice of Latinos is being taken into consideration as we're developing our work plans. And then again, one other thing that we emphasize a lot is that the vaccine is free. That you do not have to worry, you do not have to pay for that vaccine. And also another question that will come a little bit later is in regards to security, safety of information and documentation. So there are many different areas where people are concerned, but overall, I think there's a good cohesive effort to get the information to them as quickly as possible using all the means that we have at hand.
I think, Diana, the only thing I would add from what Lily has stated, we also appreciate getting the information. As I stated earlier, we get information from different sectors within our community, from the Department of Health, from Lily's office, the Ohio Latino Affairs. And because there are so many different parts, there's so many different languages spoken in Columbus, it's very difficult for some of these organizations to quickly translate the information. So with being a Latino organization with predominantly Hispanic staff, we had actually taken advantage of some of our translation skills and have taken those documents, make sure that they're verified, quickly translate the materials or the language or the facts that are important and pertinent to our community and get that information disseminated. Again, by all means necessary, social media, flyers, letting people spread the news. If they come in, we talk to them. We serve about 900 or so families from the food pantry itself. So we will add those flyers into those food boxes. Many of our families share with other families. We've shared our flyers that have been translated with other organizations if they also serve Latinos. So I've shared it with my other colleagues at Catholic Social Services and some of our other partner agencies. We reach out to our clinics. So we have great partnerships with Ohio Health, with Ohio State, Mount Carmel, Lower Light. So we reach out to those organizations that have provided clinical or medical services to our clients, and we provide those flyers to them also. So it's important to try to get as many ways of communicating and getting that information in the hands of our clients. As stated earlier, social media is not always the best, especially right now as we are targeting our older community. We have to look at how to get that information out. But also, as stated, one of the things that we also have to keep in mind is a lot of members of our community still see channel 4, 6, and 10. They look at the English media. So as long as we're providing that information and websites, that's important. The second thing that I would only like to highlight is making sure that people understand if you do not know where to go or how to get there. So there are 2 sites, obviously the Ohio Fairgrounds, and then I believe OSU. If you don't know how to get there, there are services. If you reach out to the nonprofit organizations, there are the Office of Aging is providing rides. As long as it is you're qualified to take the vaccine, they're reaching out and making sure that there is no barrier for you getting to where you need to get in order to take the vaccine.
Thank you. Thank you, Ramona. I appreciate that. Now I'd like to actually introduce everyone to Father Eduardo Velasquez from State Stephen, the Martyr Church in Cleveland. Welcome, Father Eduardo. Can you speak? We talked a lot about communication and getting this communication around the vaccine out into the community and outreach efforts. Can you speak to how you're weaving the conversations around this vaccine into well-being, taking care of your body, taking care of your family in the conversations that you're having with your congregation? I think we are having some difficulty.
You can hear me?
I can hear you now. Thank you.
Yes. We are working in this community church on the west side, Columbus, and the most people, Hispanic people, got the virus, the most families. They use home remedies for this. And now we are working, giving information, take care the restrictions, and the most people is available to receive the vaccine. They have scary and sometimes, and they are receiving from the church all information about this, and we are receiving 2 times by month to Mount Carmel Mobile. So they are help us for giving more information to our community.
Thank you. That's great work being done at State Stephen the Martyr. Another question that I'd like to kind of bring back our community leaders, we need to have trust, right? Confianza in how my information is being used. What are the conversations you're having with individuals who are asking, what identification documentation do I need to have to get the vaccine? And then, why is it so important to ensure that, why are they collecting information about my race and ethnicity? How is this information being used? And why is it important for me to share that? Leliana,
sure.
If you want to take this question first.
Absolutely. And let me start off with the importance of sharing our ethnicity and race as we are providing information. So as you know, I mentioned a little earlier that we are having many leaders from the community who are helping us in devising the strategy. And in order to be able to devise those strategies, we need information. However, the amount of information we have in regards to Latinos, to ethnicity, to race is not enough. And that is because we normally do not fill out the forms, or we don't feel comfortable sharing that information. The information is so necessary in order for us to make wise, solid decisions and strategies and plans as to how we're going to respond to the needs of the different communities. So this is extremely important. And to be very clear on this, the information that you provide is not going to be selected individually. This is information that is aggregated together to give us general tendencies about what is the number of Latinos in an area, or how many of them have been vaccinated and such. So it's really, really important that you provide that information. Folks are scared of the question of documentation in regards to the vaccine. And we know that that is a very sensitive topic. What we want to emphasize is that you do not need to show proof of citizenship or residency status when you are going to go get your vaccine. What we are looking for is for an identification that can show what is your identity, your name, and your age, basically. So we want to know your name and your age. There are many types of IDs that are accepted. Even if you have a document from your home country that is expired, it is something that you could use. Even if this document is from another state, another country, those can be used. If what you have is a matrícula consular, documento consulado, any of those documents can be used. Also, there's a big list that you can look on the coronavirus.ohio.gov that has many of these different documents. And when in doubt, again, reach out to trusted Latino organizations that can provide you with the information about the documentation needed. The information you provide will only be utilized to ascertain what is your name, your age, and if you're willing to share with us, we will also like to know about your race and ethnicity. That's the end of the stint of where we will use this information. This is not information that is going to be shared within any other government entities. This is not information that is going to be shared with the federal government or anything like that. And I think this is really important because one of the big myths that is out there in the Latino community, whether you are here documented or out of status, is that they're going to take your personal information and who knows what they will do with that. Well, I am telling you here now that that information is only for us to be able to know what is your name, what is your age, to have proof of your identity.
Ramona?
And I would only add, the concern from the community is exactly what Lily said, is what are they going to be doing with my information? Obviously, we need to make sure that our community is being, if they want to and choose to, being vaccinated. So if you can provide your race and ethnicity, it gives us an opportunity to ensure that we're reaching the corners of the city and the county where we know there's large populations of Hispanics. If we're not getting them coming, then either we're not servicing that particular side of town, there are some barriers that need to be removed. So it is essential, very similar to, we had a lot of discussions about using the same type of messaging and rollout strategy that we utilize for the census, making sure people know where they're at, where we're going, what resources are being delivered to the areas where we live and work. So I would emphasize that that is necessary predominantly for that. We do have a lot of folks, because of the COVID, the immigration offices were closed. Many of our clients have not had an opportunity to update their passport, update maybe some of their ICE identification. So like Lily has stated, we were very happy to hear from all the agencies that any form of identification with your picture ID, date of birth, and who you are is helpful. And, predominantly so that we can make sure that you're coming at the appropriate time, right? We were talking about, bringing people in according to age. So we need to know what your date of birth is. We need to know that it's you. So we're not giving 2 shots. We need to track to ensure that which vaccine you received so that we can call you back and make sure that you come back for the second part of your vaccination. So matricula consular. I know when I spent some time volunteering at the border in Texas and California, some of our separated families and some of the other families were provided some documentations from ICE. That is documentation. It's got your picture, it's got your date of birth, it has information as to who you are. So we want to make sure that you have those documentations. If you are having any issues acquiring any of those documentations, we do ask you to reach out to some of the Latino organizations within your area. Many of our Catholic organizations have contact with some of our consulados office, and we can work with those agencies to ensure that we get your passport. If you lost it, misplaced it, have moved. We talked earlier that many of our families are now living in multi-household homes. So if you moved and maybe you forgot it or you lost it or you were, whatever may have happened, we want to make sure that you have access to going out and getting those documents. It will be difficult if you don't have a document to proceed, but we'll definitely be able to work with you. And like Lily said, even if it's expired, we all understand it's been hard to renew your license, renew your state ID, renew your passport, all those documents that you've relied on. And unfortunately, there has been some of those barriers to getting those documents renewed. We are currently making sure that that information is out there, that people can bring even an expired document to ensure that they get vaccinations.
Thank you. Thank you. Thank you so much. That's very important information that will ease the hearts and minds of lots of individuals in our community. We spoke to trust, and so now let's speak to safety, right? La seguridad sobre las vacunas. Is the vaccine, is the vaccine safe, and how is safety being monitored, and what are the potential side effects of the vaccine? What's in and what isn't in the vaccine? Dr. Schwartzman, would you please weigh in on that question?
Sure. We already spoke a little bit about what's in the vaccine or the vaccines being already authorized for emergency use in the United States, the messenger RNA. I want to focus more on side effects now. So let me give you my perspective as a doctor. I'm not involved with infectious diseases. I'm a cardiologist. But when I have a patient telling me that diagnosed with high blood pressure, doesn't want to take a medication for high blood pressure because may cause swelling of the legs, which is a possibility. One of them does that. So I said, once you see a patient, somebody else who has a stroke, conversation will be different. So the conversation we have one-on-one with patients is crucial on this, and the trust patients have with the doctor is crucial. So once we see that there's no intervention that is free of side effects, and what we are working upon is much more important. So once you see a patient with COVID at a young age has pulmonary embolism and needs blood thinners for life, or has permanent brain damage, and you see that the price of that is some arm swelling of arm pain, fever, following the injection of probably the second dose, some chills, and not necessarily those side effects at all. And going back to the way the vaccines were developed, we said corners were not cut, and both the FDA and the counterpart in Europe were extremely serious on seeking for information on side effects for 2 months after the vaccine was given. Despite the process being shorter, that part was not modified in comparison with any other vaccine in history. So 60 days at least were considered after the second dose of the vaccine to look for side effects before being considered for emergency use. So that's very important to know, because it's not that everybody was in a hurry, including the looking for side effects on patients. So that was very well done, continues being done and monitored. That's part of the question, that continuous monitoring, because we are asking to a condition that was diagnosed on December 31st, 2019. It's very easy to remember. It's one year plus how many days we have in February. So it's now less than 14 months old. What are the side effects of the vaccines long term? We don't even know what the side effects long term of the condition itself are, let alone about the vaccines. What we can tell you is that compared to every other vaccine, is extremely safe, and the profile of side effects is very positive.
Thank you. Deputy Director Lance Hines, can you speak to some of those questions as well in terms of the safety of the vaccine, how it's being monitored, vaccine sort of deployment and the numbers, how are we keeping track of that information, and then, potential side effects about the vaccine, and what's the conversation that we're having in terms of easing the hearts and minds of the community in terms of what's in the vaccine and what isn't in the vaccine?
Yeah, thank you for the question. So I think importantly, the Food and Drug Administration, the CDC, independent medical experts have all reviewed the data and have determined that the vaccine is safe. Currently, over 65 million United States residents have had the vaccine. In Ohio, we've administered about 1.5 million first doses and about 700,000 second doses already. And we are monitoring for any adverse effects. And a couple different tools I want to mention. The CDC has developed a tool called vSafe, and it's a tool that would go on your smartphone. And after you get your vaccination, they will text you and do a web survey to ask you health-related questions and to see how you're doing. It can also remind you to get your second vaccine, your second shot. But in addition, you can also report through that app any adverse effects that you're having. So the CDC and the FDA are also monitoring any side effects through what we call the Vaccine Adverse Event Reporting System. And this system has been around. It records adverse events for all types of vaccines, but currently for COVID, if there are adverse events, even if they're not likely related to COVID, they can still be reported to the FDA and CDC, and they have medical experts who will investigate and look at those issues and determine whether or not there are any issues. The Department of Health also has staff that are monitoring the VAERS system, and that's the Vaccine Adverse Event Reporting System. So you can be assured that we are monitoring this COVID vaccine. The multiple vaccines will be the most monitored vaccines in United States history based on the number of vaccines that we're providing and this pandemic. So rest assured that we're going to continue to monitor, and if there are any issues, they will quickly be addressed. But the vaccines are safe and effective, and we would encourage you to make a decision, look for information, and see if it's right for you. But we definitely would encourage you to consider it seriously. Thank you.
Thank you, Deputy Director Lance Hines. Thank you. That was very reassuring information. Now, I want to kind of pose another question, and I'd like to bring in Ramona and Lily into this conversation. Latinos and Hispanics are, one of the most uninsured populations, and healthcare access and affordability for this community is a reality. How are you addressing the questions and regarding to cost of the vaccine, and how I can get the vaccine at no cost? How are you having those conversations? What do those conversations look like, sound like, feel like in the community for you?
From the perspective of the commission, is one of the major concerns that we hear from organizations in trying to convince our community that the vaccine is actually going to be free. It's hard for them to believe when they already know that healthcare in the United States is very expensive, and to suddenly hear that the vaccine is free, they have a bit of hesitation and doubt, and they're not quite sure if they should trust us or not. And so many times in my particular case, what it takes is to explain why this is not a regular situation. We are in the midst of a pandemic. This is provided through federal funding, federal guidelines. The state of Ohio has made a commitment that everyone who is eligible to receive the vaccine will receive that vaccine. We continue to emphasize that the vaccine will not cost them any money, but still, like we've said from the very onset of this conversation, this is all about relationships. Somos amigos, we are friends. Somos familia, we are family. We trust each other because we know who is giving us advice. And so that is why, once again, I must say that building that trust and that understanding is something that comes through the trusted voices of Latino serving organizations, Latino leaders, faith leaders, the Latino media, the radio stations, all these different avenues that we have to bring trusted messengers to give that word of wisdom and trust to the community, because many times it's very difficult to ascertain, am I getting the truth or not? And the thing that we need to remember here is that the pandemic has also triggered many fears and insecurities that people have carried, and now this is a new space where they've never navigated before. And so continued information on the vaccine being free is really important. And again, we continue to direct them to the coronavirus.ohio.gov website, where you can find information on all these questions, as well as where to get the vaccine. We want you to please connect with the local health departments and as well the federally qualified health centers. We have las clínicas. We have many clinics around the state that are also going to be participating in this effort. And as the vaccine becomes more widely available, there will be more ways how people will have access to that vaccine. So it's critical to stay connected, to listen to the trusted voices. We do every week, at least once a week, we have a boletín informativo through La Mega Radio, where for about 30 minutes, I present the latest updates and news from the governor's office. Many other Latino channels are doing the same kind of work. So we need to just continue to keep our community informed. And we want you to know that here we are, Latinos, working within state government, within these agencies, with your voices represented, doing the hard work to make sure that you get the services you deserve.
And I would echo what Leliana said. One of the things that we've been very intentional in doing is letting our community know that they can give us a call. Give us a call if for whatever reason someone tells you something different, or if you don't feel safe, or if you don't feel comfortable. So we make sure that we've let them know you can call us. We can actually help you make your appointment. We can help get you that transportation, ensure that it is free of cost according to where you're going to go get the vaccine. As stated earlier by our deputy, was that as it is available in other areas, be it Walgreens or CVS or Kroger's or some of the other outliers that we have here in the community, as it starts going out, there may be some cost of the administration of the vaccine. So we want to make sure that our community knows that there are some other places that are free, completely, absolutely free, that are available through our Franklin County Department of Public Health and other entities. So we encourage people to make sure that they get that information. I know that we also talked a little bit about concerns about the vaccine. Lily and others were in conversations about what's in it. People were worried about whether there was pork in it, whether there was, there was other concerns according to religion. And I know Father will talk about it here shortly. But again, going out and getting the facts to ensure that you feel safe and comfortable. But ultimately, making sure people know that getting the vaccine is free. And again, I will also repeat the website, coronavirus.ohio.gov.
Thank you. Padre Eduardo, can you share in terms of the conversations that you're having through your ministry with your congregation, the questions in terms of the vaccine and how they can get the vaccine and the safety of the vaccine and the alignment to one's faith?
Yes, our community, Latinos people, they entrust on the authorities. They know the vaccine is free, and they even receive many supporters in this challenging time. So they entrust in the authorities. And also, we are working in this community. The majority is Latinos people, but we have the minority Anglos people. They the most have received the vaccine. They didn't feel some negative effects. So the most people are waiting for their turn for receiving the vaccine.
Thank you, Father. I want to thank everyone for joining us tonight for this important conversation on COVID vaccines and it's the importance it has in the Latino community. I also want to thank our panelists, Executive Deputy Director of the Ohio Department of Health, Lance Hines, Dr. Raul Schwartzman, Medical Director of Cardiovascular Medicine with the Cleveland Clinic Foundation and also CEO and founder of Foundation for a Fair Future, Ramona Reyes, Director of Our Lady of Guadalupe Center of Catholic Social Services, who also serves as Vice President of the Columbus Board of Education, Leliana Kavanaugh, Executive Director of the Ohio Latino Affairs Commission, and then lastly, Father Eduardo Velasquez of St. Stephen's, a Martyr Church. And also special thanks to our live production crew working behind the scenes to really make this event happen tonight. Additionally, we want to have a special thanks to our sponsors, CAS, the Ohio Department of Health, the Ohio Department of Mental Health and Addiction Services, the Governor's Office of Faith-Based and Community Initiatives, the Ohio Latino Affairs Commission, and the Appalachian Ohio Commission for today's town hall. This town hall will be re-aired on the Ohio channel on Saturday, February 27th at 7 p.m. and on February 28th at 3 p.m. And all those town halls can be watched on demand later at coronavirus.ohio.gov. Just a reminder that the next town hall in this series will feature panelists from Ohio's Asian American Pacific Islander communities. And that town hall is going to be aired live on Monday, March 1st at 6:30. Again, I want to thank our moderators. I want to thank you for joining us in this important conversation. Gracias por conectarse y unirte a esta conversación. Good night. Buenas noches.